Hello. How are we? All good? Fantastic. Good stuff. I've first of all been stitched up here from our graphic design team. They promised me that they were going to change this to Hello REBA, and they've kept it and sent it through. And when I was checking through the slides at the back with the audio visual, they've done me there. So thank you very much if you're watching this to the design team. So Hello REBA, first of all. Quite a controversial topic that we're going to talk about today. Maybe a bit of a clickbait title, so I apologize for that in advance. But I promise you there's going to be so much that we can take away from today's session. We're going to be talking about the latest research and evidence when it comes to well-being, what we can do to really drive engagement within our teams, really drive that return on investment that we know is so important to be able to justify the spend and investment, and also to be able to allocate resource really effectively when it comes to our well-being strategies going forwards. But then also looking at how we can impact more lives. I'm going to touch upon that and my personal story as to why this means so much to me, and you'll hopefully be able to hear that in my voice throughout. But there are three things that we're really going to cover together on today's session. The first one is why we're in this place at the moment, and a quick show of hands if you are looking to really drive engagement and boost engagement when it comes to well-being, reward and benefits services in your organisation at the moment. So a quick show to be able to justify the spend that you're looking for, and just keep those up if you're wanting to drive more impact with more lives across your organisations. Fantastic, this session's for you. So, what we're going to touch upon is, first of all, what we really need to focus on. Let's go back to basics. For my simple mind, that's the way I normally do this, is we've got an amazing team at Champion of 120 health experts that have collated millions of data points from across the globe. We're live in 122 countries, so if you're a global company, this is also really applicable to you. And so we're going to go back to what we really need to focus on to drive that impact going forwards. The second thing that we're going to focus on is then going to be about how we can, the actual problem that we're looking to solve as well, and why we haven't really accelerated, because I see so many providers here at the moment, and I'm not going to provide a bash because everyone's trying to achieve the same thing, but the way that we've gone about it might not have been the best thing so far, because we're not seeing the impacts across the whole of the industry that we need to. We've never spent so much money when it's come to workplace health, but workplace health isn't bettering, arguably it's worsening. And then the third thing we're going to focus on today, and the most important thing, is what can we do about it together? What can we do to drive change together? What can we do from the latest research, evidence, and what can we action going forward? So that's where about 15 minutes of the presentation is going to be. The first bits are just going to set the scene. So first of all, why are we in this position? And just excuse some of the awful slides that we've got. The first one, you'll see the second one, I'll go into that in a minute's time. The first one is because why we're in this position is because it's a fairly immature market still. Really, when we look at reactive services when it comes to well-being, it's quite a mature market when it comes to private medical insurance, employee assistance programs, physiotherapy. And when we talk about reactive services, it's when the problems occurred, and we really do need that still. But when it comes to proactive well-being, when it comes to prevention and then the early intervention, it's still fairly immature. And back in 2016-17, there was a lot of movement within there because of the Deloitte reports that were coming out. And obviously in 2020, a big thing shifted as well when it came to well-being within here. And that led to a lot of organisations panic buying somewhat, and that's where the toilet roll link comes in. I'm not going to mention that C word anymore, I promise, but there was a lot of panic buying when it came to wellbeing services, that we need to support the whole of the organisation, not just the 20% that may be struggling with mental health challenges at any given time, or the 30% that is struggling with back pain. We know the real importance of proactive wellbeing when it comes to it. And so that led to long contract terms that providers were rubbing their hands together and going, we can sign you up for 3 and 5 years, and then us going, actually, this hasn't worked, and why hasn't it worked? And that's something I'm going to touch upon on today's session and be really honest with you guys from a provider ourselves, and hopefully you'll be able to ask other providers some good questions going forwards. And the third and final thing, we've got some Champion branded noise cancelling headphones. Another quick show of hands if you think the wellbeing space is noisy. It's quite literally quite noisy out there. I'm struggling to think sometimes when I'm speaking to some of you. It's a really noisy space. And this is where we want to cancel out the noise to be able to give you clarity in your decision making and for your wellbeing strategy. And whether that's procuring wellbeing services and interventions externally, or whether that's planning internal communications campaigns that you can do within your teams, I want to provide you with these headphones today. So when it comes to the thing that we're trying to solve at the moment, This is the golden triangle, and this is what, off the back of all of our research with amazing people in this room and thousands of reward and benefit, HR and wellbeing leaders, and when it also comes to speaking to FDs and CEOs, these are the three key themes that are coming through when it comes to why we're doing what we're doing. The first one is engagement. And without engagement, we can't then drive a return on investment. We can't impact lives within there. Exactly the same when it comes to impacting lives and exactly the same on return on investment. All of these three things are interlinked. So when we speak to organizations and they're saying we're getting 2% engagement with our platform or with our EAP, that means that we're not going to be impacting lives. That means there's not a return on investment and then it goes back up. So we need to really focus on these three things. And I think that's where we always need to always come back and review when it comes to well-being and justifying the resources, the interventions that we put in place. Of course, when it comes to impacting lives, we know that well-being somewhat is worsening within certain areas, yet there's been more and more interventions, as I've mentioned. So hopefully going to give you clarity with 8 key points off the back of our global research that you can do going forwards. So just bear this graphic in mind as we go through all of this, because this is what we're looking to achieve as a team together on today's session. So number one, when it comes to the 8 points, is there one place to bring all of your wellbeing services together? And so I'd just like you to ask that question to yourselves, or is wellbeing at the moment really fragmented? When it comes to wellbeing at the moment, we know there's so much noise, as I've mentioned, all the way through this talk. And speaking to Phil Hain at the start of today's session, who puts on the REBA events, who speaks to all of you as well, he said this is now the era of consolidation. How we can bring things together into one place, make it seamless, and everything's one click away and easy to find. And one of the things that we've looked at is why is it that Netflix, Apple, Spotify, Amazon get us coming back to these platforms or these products and services so frequently? When I've got my mobile phone, for example, and if we look at the wellbeing landscape at the moment, it's following very much the same journey that the iPhone went on in terms of the market. And so I think previously, back to when I was a little bit younger, when I had the Nokia to do my Snake, do you remember that game, Snake? It was amazing. All my text, phone calls, that was just on my Nokia. I then had an alarm clock. I then had an iPod for my music. I then had a physical calendar. And that's exactly what Steve Jobs and Apple did, which seems not revolutionary now, but back then, oh my word, it was something that was absolutely incredible. All of your things on one device. When we look at Amazon, it's my nephew's birthday tomorrow. I've slightly made an error because I forgot that. I can go on Amazon, everything in one place. It might be for my dog Barry that I need to get him some, I don't know, shoes or something because he's been a good boy, all the way through to my present for my nephew Oscar at the click of a button. When it comes to Spotify don't just look at one area of music or just look at podcasts. They look at all of your Arctic Monkeys and ABBA, which is my 2 favorite bands, all the way through to your rap and classical music, for example. So there's so much that we can learn when it comes to bringing well-being together within our organizations. And that's the first thing that we need to do, is have we got one centralized place that's really attractive for people to understand where our services are. The second area that ties into this is, does that place then integrate with all of your services that you've got? So there's no provider out there that does absolutely everything. Champion Health goes a hell of a long way, but there's no provider. It's impossible to be absolute experts in every area. So it might mean that you've got private medical insurance somewhere. The policies might be different across the organization. It might mean you've got physiotherapy, EAP, menopause support policies or platforms, for example. But this is where we need to integrate these services, again, at the click of a button. And I had a friend recently that is working for a global company, and he was experiencing a really high level of anxiety. It was really hard to see because he's the life and soul of the party. And he said, it's the first time I've experienced anxiety. I don't know where to go. I said, just see if there's anywhere where you've got an EAP within your organization. I'm fairly confident you will. And it took him over 2 days to be able to find it. He was sending emails to HR, so that was taking up HR's admin time. He then found it. It then took ages to be able to get in touch with the provider, and it didn't fully integrate with the existing services, and everything was siloed. So what if we could have one platform that brings everything together at the click of a button? That individual, my friend Will, would have been able to access that support much faster and much earlier. And when it comes to mental health outcomes as well, we know it's drastically more likely that the individual is going to be in a better place much faster if they access support faster and earlier than before. Now, similarly, one of the tragic stories, and I see many familiar faces in this room today that will know my story when it comes to well-being. I lost my mentor 6 months into Champion's journey due to a short bout of stress. He ended up taking his life, and he is one of the most incredible people, and we would not be supporting 2 million lives today in 122 countries if it wasn't for James's help and support. when we spoke to that organisation, going to remain nameless, but we spoke to them and they said, we've got all of these services. I don't know why James didn't reach out to them. And again, it took ages when I just trawled through it to find it. It looked clunky. It wasn't a good user experience. And if someone's in crisis, and we know 9% of our organizations at any given time are experiencing crisis, which is a horrifying statistic if we've got 10 employees through to hundreds of thousands of employees, which some of you do have, making sure that things are easy to find can quite literally be life-changing and life-saving. So these two tie in really closely together. Is there one place, first of all, and do the services integrate? The third one is then, are the offerings relatable and inclusive? And these two things are slightly different. When it comes to relatability, there aren't that many Pretts in Sheffield, where I'm from. There aren't that many Gregs in London, where I'm down here at the moment. And so how can we make wellbeing really relatable for the whole of our population at the moment as well? How can we make it relatable to the 50-year-old female or the 20-year-old male? How can we make it relatable if you're experiencing a mental health challenge and you're from a different demography to someone else, for example, or a different race, gender, etc. And so making sure that the providers, first of all, and second of all, if we're doing internal things, things are relatable to that individual. One of the comparisons that we also drew was marketing campaigns. And a lot of what we're looking to do with our wellbeing campaigns is around communications and reaching people. And to be relatable, that's all communications. So making sure that we've got a diverse talent pool in terms of our internal team that are talking about it, but also the providers that you choose. If it's an EAP, you need to make sure that they've got options to be able to select a specific belief system, for example, for that counsellor. That's a really important thing within there, that it's not just people that look like me, because then we'll just get people that look like me using that service. And also with inclusivity, that ties in very, very heavily as well. There's one example too that we saw recently where a step challenge was implemented in an organisation. They can be really effective, step challenges. Some people say a bit gimmicky, but physical activity is really important, can build social cohesion. And one individual within that team said, this actually has done more harm than good because I'm using a wheelchair. And what can I do about that? And so they immediately discluded, and one of the things that my professor previously said to me, Professor Jim McKenna, amazing guy, is there's no effects without side effects. There's always an unintended consequence of the interventions that we plan. So always, again, just go back to that inclusivity and back to people that may be less privileged than I, for example. The fourth thing is then personalisation. And this really ties into that relatability within there as well, is making sure that the service is really hyper-personalised to the individual's wants, their needs, and also their challenges when it comes to well-being. If things aren't personalised to me, I'll stop using it. If I think about the consumer-grade apps, which I'm going to talk about shortly, they're all hyper-personalised to me. I'm able to go through a short profiling section where it will learn more about me through AI or algorithms, for example, or speaking to a human, and then it will really tailor those things to me. So if you're planning an internal communications program, for example, and you've got different departments, try just tailoring the message and working with your comms team, for example, in tailoring that message to the sales team or to the marketing team or to the development team or what other team you have. It might be a shop floor team, for example. So making sure everything is hyper-personalised along the way. And again, if you're choosing providers, make sure that they're making it personalised, because that's one of the biggest reasons why average engagement rates are between 2% and 6% from all of the research that we've done when it comes to well-being. Of course, then that will have a massive impact on return on investment and the impacting lives, the moral case and the business case. Number 5 is it a consumer-grade experience? I love this slide. I'm glad that they kept this in and not changed this one. So does it align with consumer-grade experiences? This is really key when it comes to choosing wellbeing apps, services, or even planning campaigns out there. If we're not going to buy it ourselves, we can't expect our team to then use it. And so one of the things that we see in procurement stages, especially with large companies, is that we get asked loads of questions that are really important. A lot on data security, really important. A lot on average utilization rates, really important. But one of the biggest things and one of the biggest factors is, will employees really use this? Create employee forum groups to be able to get a diverse talent pool, again, or a diverse group of people to be able to understand more, and will they use it? Will they buy for it? Will they buy it if the organisation isn't providing it to them? That's a really good lesson in, are we going to get the 50, 60, 70% engagement rates that we know we can get within our organisation? So making sure that consumer grade experience, that Apple, Netflix, Spotify experience is there when it comes to your wellbeing provision. And this is one that the marketing team really didn't like, of the Hovis best of both. And at the moment, I'm not going to go into politics too much, you'll be glad to hear. But the world's becoming increasingly polarized when it comes to so many areas. The blue corner versus the red corner. It's Brexit versus Remain, for example. And the more I actually speak to people in wellbeing, the more it's becoming quite polarized as well, because budgets are tightening, things are really hard at the moment. And so there's a lot of conversations on, is it EAP or physiotherapy we need to focus on? Is it mental health or financial wellbeing? Is it proactive or is it reactive that we need to focus on? And the answer really is the Hovis best of both approach, where you get the brown bread and the white bread within one. And so that hybrid approach is the most effective thing, that we're not just looking at preventing health issues, we're also looking at the early intervention, because we can't prevent every single health issue from occurring. But if we just look at the late stage chronic conditions, for example, long-term absence, and we forget about the population at the start, that's when we're more likely to have a large population that we're serving there. So making sure that we are proactive and reactive, we're focusing on all areas of well-being. A lot of organizations again are saying we're just going to focus on financial well-being, make sure the data's there to really support it, and that's something I'm going to come on to shortly. I went to see Chic and Nile Rodgers on Sunday, actually. I know this is Sister Sledge, but they did We Are Family. I bought tickets for my family for Christmas to go and see them. It was absolutely wonderful. I did a lot of my dad dancing there, even as a 30-year-old. So I went to see them, and this was something we included quite late on, is that it's not just about the employee experience. And I think there's some amazing people in this room that are looking beyond the employee to their family and to their kids as well. And a story that I'd like to share with you is that when my dad, sadly, was diagnosed with terminal cancer a year ago, I think I underestimated the impact that that would have on me when it comes to my, first of all, well-being, but secondly, to my work and productivity. And the support that the Champion team gave, the team around me, but also the platform did, around understanding more around this process, for example, and also then being able to support my friends and family within the offering, it had such a huge effect and impact on me. And we're talking to other people at the moment that are using that specific feature where they can share the platform at no additional charge with 3 friends and family members. And that's having a huge impact. Because if my mum's struggling with her anxiety, if my best friend is struggling with their finances and struggling to make ends meet, what a beautiful thing it is that we can say, as an organisation, we can go beyond the people within here, and we know that's going to have an impact and that return on investment again. And something that's about to go live shortly is Champion Kids as well. Something that's really important, I think, that when we look at the data, 50% of diagnoses in adults, when it comes to mental health issues, have actually been diagnosed before the age of 16. So making sure we're supporting that next generation is a hugely important thing, and that's something that we can focus more on. And lastly, and probably the most important one when it comes to well-being, is then the data. Are we collecting the right stuff? And that's a big question that I'd love you to just sit back and think about. Are we collecting a lot of reactive data? Often the answer is, yes, we're collecting a lot of reactive data. That might be around claims data with private medical insurance. It might be around EAP data and utilisation or physiotherapy. It might be staff turnover and absence data. We know this looks at a small proportion of the workforce at any given time. What about the proactive data? What about the people that are turning up to work that aren't absent, that may be struggling with their well-being or might actually be absolutely thriving within there? We need to collect that proactive data to build a well-being strategy where we're not having the guesswork within well-being. We're really able to make those data-driven decisions. And this is where we'll exit through the gift shop shortly. Before the summary, I'll share a tiny bit about Champion, but we need one place for everything to be within. Services need to integrate with each other when it comes to well-being. Offerings are relatable and inclusive within there. If we can make it personalized, that will have a huge impact. And I must say, if we miss one of these things off, that's where engagement rates can really drop. We know that would an employee buy it? If they are saying yes, if the team is saying yes, that's where people are going to utilize it. The hybrid approach, is it something that is just proactive or just reactive, or have we got something that joins up all the way through to support beyond the workplace and collecting proactive data? So I've got 1 minute 30 left on the clock, so I'd love to open it up to questions shortly. But we're on stand 32, we're a smiley bunch. Would love to be able to have a conversation about workplace health and see if there's any opportunity and if anything resonated with you within there to be able to drive greater engagement with your organisation, to be able to generate that return on investment and prove it, and also to impact more lives like James, like my friend Will, and like all of your team going forwards. So thank you so much for taking the time out today, and hopefully we've got a minute left for questions.